there, this is Casey Green. I'm a pharmacist and certified functional medicine practitioner with the Innovation Institute. So today we'll be talking about IV nutrition therapy, especially the Myers and Immune Boost protocols available at Innovation Compounding. So the objectives of this presentation will be, first, just what exactly are the Innovation Compounding IV protocol kits? Why would you use them? How do they come? All those types of questions that we typically get. We'll look at health conditions overview, when these IV kits might be used, when they're useful, what other practitioners are seeing good results in patients with. We'll look at best testing and monitoring practices so that you can best ensure safety for the patient, see where their deficits might lie, where you can achieve the best results as well as keep the patient safe, of course. And then we'll look at customizing IV protocols in case your clinic wants to specialize in even further objectives, whether it be weight loss or whatever different kind of niche that you're kind of specializing in marketing. So why would you use Innovation IV protocol kits? So for your clinic, these kits make the whole process easy, fast, affordable, and effective. So that's why so many clinics love using them. They're very easy in that it comes set up for you in a protocol that's already been used tens of thousands of times, very well proven, tried, tested, all set up with easy directions for you. You don't have to be an expert or go through years of training and board certifications to get started in this. Very fast, because again, it comes to you all ready and good to go. Very affordable, as most of the kits, these kits especially, come with 4 infusions per kit. So makes it very affordable for you in your clinic to deliver these IVs to the patients, and just flat out effective, because these are the protocols that, again, have been tested tens of thousands of times, and many practitioners have gotten great results for patients using these. So what exactly are the Innovation IV protocol kits? So again, just heavily tested and very validated vitamin and mineral IV protocols that you can trust, again, used tens of thousands of times, very safely and with great results, come set up to meet your various clinical goals. As you can see here in the picture, the sheet that's behind the actual kit with the nutrients actually outlines, you can see like magnesium chloride there, for example, infusion volume of 7 mLs. So those infusion volumes are how much to draw up of each of the items in there. They each come in the individual multi-dose vials that you draw from to add to the IV bag. So very simple and clear-cut directions that just make it very easy for your clinic. Just to give you a good standardized protocol. It makes ordering easy, administration easy, the whole process, it just makes much easier. So how are they supplied? So they come in multi-dose vials, and the reason we do this is because it makes it much more cost effective. And typically with these protocols, the amount of benzyl alcohol preservative is not clinically significant. So it just makes it much easier and possible for one kit like this, for example, to allow for 4 infusions, since you can pull out of the same vial multiple times within a 28-day time period. So again, 4 infusions per most kits, and standard direction handout, as you can see again there, just makes it very easy for you. So how are they used? So the protocol handout makes it super easy again. It outlines exactly what to pull up of each individual ingredient. There are different ways you can use it as a push versus a drip, and I'll cover more in detail the options there a little bit later in the presentation. But as far as which nutrients to actually draw up, it's all clear cut in there for you. How much to draw up, we make it really simple for you. How much carrier solution to mix. So there are a lot of options here. Our handouts will reference the IV push option, which is the quickest and simplest option. But depending on what you're trying to achieve at your clinic and what type of experience you're trying to give the patient, obviously drips can be better in certain situations. And we have a ton of providers that do the drip option. And again, we'll cover what kind of IV fluids and times and things like that might be used for those. But you wouldn't actually need a different kit. It'd be the same kit, the same amount of infusion volume of each nutrient to draw up. It's just potentially a different IV bag type or different size that allows for perhaps a longer infusion in like a med spa environment, for example, that offers like a nice experience for the patient. So are there regulations I should know? We get this question all the time. So of course, yes, there are, and it comes down to a state and federal level. And the individual states can vary significantly. At Innovation, we've worked with every state in the United States and seen a lot of the differences. USP 797 is a group of experts in different areas, and it covers everything from engineering to different sciences, but it also covers compounding and administration of drugs and things like that. So they have standards on those that are written by experts. And then if your state chooses so, that will be enforceable. So 797 is not a law in and of itself, but it is enforceable if your state chooses to enforce it as a standard, which makes it kind of a good non-biased way, since a non-biased group of experts come up with the standards, and then your state can choose to just enforce it if they decide that's a good idea. So the best thing I can say, while I can't answer all your questions here, and I'm not a lawyer, I don't claim to be legal counsel, but just think in terms of compounding and storing medications versus simply administering medications, and which are you doing? So you're going to be much safer if you're purely on the administering side. Of course, you might mix a few things together right before administering to the patient, but that can all basically be considered an administration window for the most part. Whereas when you get into heavy mixing and especially storing things away back on the shelf to be used later on, after they've been mixed in a bag, for example, then you get into the rules of 797 and assigning beyond use states or BUDs. And that becomes a whole nother set of problems that your clinic could potentially have to deal with. So while you can adapt to anything you want in your practice, we normally recommend, for the sake of simplicity and least liability, that you try to stay on the administration side. So for example, let's say you get an Innovation Myers kit and you've got a patient coming at 3 o'clock that day for an infusion. We would recommend that you not mix that infusion in that bag until you see that patient walk in the door, even if they've got an appointment, even if they normally show up all the time previously. We would recommend that you not mix it until right then at that point in time. And that keeps you more on that administration side of things. It makes sure that the different components in that bag don't start interacting and potentially breaking each other down. This is largely the reason that we have all the separate vial components, keeping the ingredients largely apart from one another for long-term storage. But then once you mix them in that bag, they start interacting with one another. So the stability begins to be compromised. Plus, you don't want to get into the whole issue of, again, signing beyond use states or BUDs if you had to go store that bag again, because it's likely that it's not mixed in a sterile room that's certified, for example, and under 797 standards of compounding. So at that point, you really don't want to mess with storing those items. And just to be clear, this doesn't mean the multi-dose vials that come in the kits, because you're not technically mixing what's in that vial, you're just pulling from it. Those get 28 days from puncture. What I'm referring to is when you mix the final admixture in either the syringe or the IV bag. That's the part that I wouldn't mix until the patient shows up, and generally wouldn't try to store and assign some kind of new expiration. So do you need a clean room or sterile compounding hood? In most cases, I would recommend that you probably don't, and it wouldn't be cost efficient for your clinic. There's a lot of different scenarios and business models. So of course that can't go across the board for all, but I would just say that if you are going to get a clean room hood, it generally needs to be in a clean room as well. And the hoods, the clean room, everything needs to be initially certified and recertified out every 6 months from there on. To meet some pretty high standards requires HEPA filtration inside the hoods and the room. They have to meet a lot of tight requirements. And then if you do any hazardous compounds, it gets even stickier than that, and starts to get into other USP regs like 800 potentially. I will note that there's upcoming 797 updates that are back and forth and being discussed right now. And currently we're in a comment period for that, where you can comment to USP, but there's always changes going on that's worth keeping up with. But there's potentially some rules that could be down the pipeline if the new 797 that gets published that might make it more clear what administration versus when 797 regs are needed to be utilized. So hopefully that clears that up once those come across. But for now, again, takeaway, I would just make sure that you're on the administration side, mix after the patient shows up, administer the medication, and don't store your admixtures. That's going to keep you on the safest side of this. And beyond that, I would just say check with your state regulators and see what they are enforcing, what are your local state regs, and what do they actually care about. So how long can the kit be used? We get this question all the time, and I've mentioned it before briefly, but so USP 797 recommends to use within 28 days from puncture. And these kits are made up of multi-dose vials preserved with benzyl alcohol, typically 0.9%, which is kind of the pharmaceutical standard for preserved solution. Generally tends to be non-toxic as long as used within reasonable means. And but the 28-day puncture rule, a lot of confusion comes about as to why the 28 days and why is the vial technically expired at that point. And the reason is to minimize infection risk, not based on stability. So it's not to say that X ingredient in this vial is no longer potent or would be chemically useful or effective. What it's saying is that the risk of infection after 28 days is just considered too great. And it's not necessarily an exact science, but USP had to make a cutoff somewhere. And generally a month supply from one injectable vial is pretty good practice. So yeah, just make sure once you initially puncture those vials in that kit, if there's several vials of magnesium, for example, I would only puncture one at a time, because then you're running that 28-day clock. And that way the unpunctured vials still have the ultimate beyond use date assigned to that medication, and not, so only the punctured ones have the 28-day expiration set at that point in time. And this is just, even though it is preserved with benzyl alcohol, preservatives don't hold out forever, because you got to remember, typically when these are being drawn up in clinic, it's not in a clean room environment. There are microbes around everywhere, and the vial does get contaminated. It's just that generally it's considered for 28 days that appropriate preservative can keep the medication safe by keeping any microbial growth well under control. So now looking more specifically at the Myers versus the Immune Boost kit that Innovation supplies. So the Innovation Myers protocol is the core formula, kind of like the backbone of a lot of different protocols that different clinics, practitioners might use. And I usually try to break it down that way just to keep it simple. But basically that's giving you the core vitamin and mineral, kind of think of like your general multivitamin mineral in the IV form. That covers a lot of bases and just makes up for a lot of nutritional deficiencies. And a lot of that can be behind a lot of these disease states. So that's why this backbone can be so useful. And then you can add on to this potentially afterwards, or modify it as you become more experienced and understand how to do things safely, or learn of other nutrients that might have additional clinical benefits. But as you can see here, the minerals included in the Myers, magnesium, calcium, and selenium. And then vitamins basically have a series of B vitamins as well as vitamin C, ascorbic acid, and B complex, which includes a couple different B vitamins, just because of the way Myers is typically set up classically. Sometimes it would use a B complex, but we additionally have Boost and some of the other critical nutrients. The Myers Immune Boost. So the Immune Boost kit builds on that core that I mentioned was established by the Myers Protocol kit. So the Immune Boost has everything that's in the Myers. So it's got your core bases, your covered, but then it adds 2 ingredients to it. So glutathione and acetylcysteine. And what this does, it adds additional immunity boosting and detoxifying benefits from both of those, as they're both detoxifying agents that are critical for your liver, especially since in our environment nowadays, we're all exposed to all kinds of different chemicals, from whether it's things we apply to our skin and use, or just things in the air, and even different products and preserved foods. Our liver basically needs help at detoxing, and that's what the glutathione and acetylcysteine can provide. And we all know in these times, with COVID around, that anything that's immune boosting, supporting, of course, potentially really helpful. So this just, again, takes on that core of the Myers and adds a bit to give it a boost in immune capabilities as well as detoxification. So, and it is worth noting that while the Myers is all room temperature products, the Immune Boost kit, so it has glutathione, which has to be refrigerated. It does have to be shipped and stored refrigerated. So that glutathione component will be packaged separately from the rest of it, as everything, like in the picture, for example, would be stored room temperature based on our stability testing. And the glutathione will be stored in the fridge to maintain the potency labeled on the beyond use date. So what's not included in the kits? This is a good question to ask as well. So innovation only covers the actual nutrients that have to be compounded to go into the IV bags. So I guess you could say we only include the clinical part, so to speak. Whereas the IV carrier fluids, whether it's normal saline, half normal, D5W, lactated ringers, whatever it is, that's the clinic's responsibility to get those, and they typically do that from their wholesaler. IV lines, syringes, pumps, all the medical administration type of parts and other supplies, those are not included with the kits from innovation. So again, just the nutrient part, the actual clinical part to administer, but we do not supply any of the medical equipment parts. So now we'll look at some health conditions that could potentially benefit from use of the Myers or the Immune Boost protocols. So Dr. Alan Gaby is a renowned expert in IV nutrition, and he's used the Myers cocktail for these conditions and more. All the conditions listed here were especially noted in his research to receive benefit from using the Myers. And the addition of glutathione and acetylcysteine in the Immune Boost kit just adds extra benefits, again, of immune and detoxification support. So, and then the additions of other ingredients or combinations can open up a whole other world of possibilities, really. You could easily argue that nutrition is the foundation of our health, at least the part that we can control, and then medicine needing to step in where the patient needs even further support based on diagnosis and treatment. And the classic example would be trying to reverse type 2 diabetes through lifestyle and improved nutrition, whereas medications should really come secondary to that, but of course are in a lot of cases needed for additional support. But Dr. Gaby and thousands of other practitioners have seen great results in using the Myers and similar IV nutritional support in millions of patients. So testing and monitoring, what types of testing and monitoring should you use? Well, it's very condition and treatment specific because these are different patients needing a medical workup. I try to suggest that Just because it might seem like a simple IV of nutrients, it is still definitely best practice to get a full general medical workup. A good start in any case, any patient really though, is a CMP, especially wanting to look at electrolyte status, because I mean, we are looking at potentially putting in magnesium, calcium. Some practitioners will add potassium. So those can all have a big impact, especially if renal function is not sufficient for proper excretion, to where the body can't properly maintain and manage those levels. So knowing that electrolyte status and renal function, that's very important in these IVs, because even though they might seem like nutrients and it might almost look like a multivitamin mineral in an IV bag, the IV form is very, very powerful, just as powerful as most drugs. So it's something that we really should do a good medical workup on. Some other conditions, although it's, again, patient by patient, could be heart failure or any sorts of renal insufficiency, because those will affect the body's ability to handle these fluids and electrolytes. So safety practices. Of course, this isn't the fun part where we get the patient great results and see them excited to come back to clinic and seeing that kind of success, but we do have to make sure the safety practices are in place so we don't have those bad incidents with patients, and certainly avoid patient harm. So first off is osmolarity. And in my experience doing this for about 8-9 years now, is that osmolarity is typically not trained or well understood by most practitioners. It just doesn't seem to really be hit in the basic training, but it is very important, and it should always be checked and calculated on all your drips with no exceptions. So what we're really talking about is if you think back to biology class, and we're looking at osmolarity and how water shifts across membranes based on how much solute is on one side versus the other, whether that's a salt like sodium or chloride or whatever it might be. So we've got isotonic, hypotonic, and hypertonic states. Iso basically means the osmolarity is similar to that of the blood. Hypo means it's less concentrated in solute compared to the blood, and then hypertonic, more concentrated in solute compared to the blood. And this is not speaking to the concentration and say, okay, this drug product is 100 milligrams per ml. I'm not referring to that concentration. Osmolarity is different from that. So osmolarity actually deals with the number of solute particles, even from the different salt forms of the products that might split and break up and have different electrical activities within the blood. So I'll cover that a little more on the next slide, but also just know that the general clinical side effects of different agents used. So for example, with calcium and sometimes potassium will be added by some practitioners in some cases. With either of those, too much too fast can definitely cause heart issues, affecting the speed and rhythm of the heart, because they affect that electrical current that keeps the heart going and keeps it going the way that it should. So huge bursts of calcium or potassium can certainly have negative effects if not used properly, and the majority of incidents related to that are from too much too fast. So just know what you're doing with the dosing. Always consult the pharmacist if you need help that's experienced with this type of thing. And just know these nutrients are, again, just as powerful as most drugs when used in the IV form. So we have to be careful and not just assume they're completely foolproof multivitamin minerals that the patient might take in oral form, for example, as a supplement. So again, complete medical checkup recommended. And as well as having an emergency crash cart on hand and being ACLS trained on how to actually use it is well worth the time and the money. Even though a lot of clinics won't ever have a serious side effect, and some have gone even tens of thousands of treatments within a clinic without having issues, that's likely if they're working within established protocols that they understand very well and they're doing a very good medical checkup on the patient. But there's always the chance, even if everything is done perfect, that the patient could have an anaphylactic reaction to one of the ingredients. in which case you would need to be able to handle that immediately and accurately and effectively. And you just definitely want to be prepared before it's too late. Just go ahead and put in the time and money, just get that training and understand those basic safety protocols and how to use that crash cart, but for the sake of the patient, your license, and your business. So now a little further into osmolarity. Again, always check it, no exceptions. If you're doing the same drip over and over the exact same way, just document the same osmolarity that you've already verified. But if you're modifying your drips, putting in a different size bag or push or different kind of carrier fluid, any change you make whatsoever, you should calculate and check the osmolarity. And Innovation Compounding does offer an osmolarity Excel calculator. So if you're using the IV nutrient supply specifically from Innovation, you can easily use that calculator to punch in how much you're pulling up of all the individual items, whether it's say 5 mLs of magnesium, 2 mLs of calcium, and on down the line, and what kind of carrier fluid you're using and how much, say 1 liter, half liter, what have you, and it'll easily calculate that for you so you can document it and make sure it's safe. So now on tonicity and why it matters. So osmolarity and tonicity are essentially the same thing, but tonicity simply expresses how close the osmolarity is to our blood. So isotonic basically means that the osmolarity is within similar range to our blood, so it doesn't have very much of an osmotic effect on it. This is generally where you want to try to be, although a lot of drips will not be in this range. And drips can be done safely outside of this range to certain extents, but just know isotonic, generally, if you can achieve that, is the safest range and can be infused the fastest without issues. Now, hypotonic, generally considered less than 240 milliosmoles per liter, that actually can be potentially the most dangerous, although slightly hypotonic solutions can actually be really good for hydration, especially if you work with any kind of patient that for some reason is severely dehydrated, whether that's athletes or triathlon runners or somebody like that that comes in and or like a hangover drip or something like that, could be better potentially to be on the slightly hypotonic side. But what you don't want to get into is the range of an extremely low, very hypotonic solution that's, for example, well below 200 or especially below 100. I've seen clinical cases of those where, for example, maybe a 1 liter bag of sterile water is used when not nearly enough ingredients is added. So a 1 liter bag of sterile water would not be an acceptable option for the carrier fluid bag for the Myers or the immune boost push discussed here, because they simply don't have enough solute added to that bag to get it anywhere near isotonic. So then what starts to happen at this very hypotonic state that's almost completely diluted out is it'll actually start lysing the red blood cells. And there's clinical cases of where practitioners have done this, not understanding osmolarity, and either the patient pulls the IV out of their arm because their arm starts turning red from that hemolysis occurring in the arm, or if they actually make it through the infusion, they're nauseated, vomiting, and urinating blood for the next day or two. So definitely gets pretty dangerous to get in that very hypotonic zone. So just understand that can be the most dangerous, and you don't want to go too low. But again, slightly low is okay and can make for a good dehydrating drip. Now, hypertonic is going to be more concentrated in solute than the blood. And generally, that's going to be considered greater than 375 milliosmoles per liter or more. Of course, it gets more hypertonic as it goes up and up and up. And although hypertonic is generally safer than hypotonic, you do need to infuse the drip slower and slower and slower if using a peripheral vein in a hypertonic solution. Otherwise, you basically risk hurting the vein and causing issues with the peripheral vein. Hypertonic doesn't matter as much if you have a central line, but in a lot of cases, a lot of practitioners we deal with don't have that. So just know hypertonic is probably going to mean a slower drip. it's very hypertonic, sometimes you might want to consider switching to a different carrier fluid to get that down, or even taking out some ingredients. So customizing IV protocols. So a lot of times we get asked, can I further customize the innovation IV protocols? And the answer is yes. But I will say if a prescription is written a certain way, that you should administer it as written on the prescription, because it is very valuable to, especially looking at some of the previous adverse reaction examples here, it is very valuable to have an experienced pharmacist review the directions for these orders that you've written. It just better helps ensure that everything is done correctly, nothing is transcribed improperly. Say if who knows who's actually writing the prescription, or if some other office administration has to enter it electronically or what have you. Sometimes things can get entered improperly and the amounts could be off. So it is very valuable to actually write that prescription the way you intend to infuse it for that particular patient, and to have a skilled pharmacist reviewing and checking those orders. So you can do these a la carte, and you can, as well as doing the Immune Boost or Myers kits and then doing a la carte add-ons to that. It's just that you need to make sure you're checking, again, the osmolarity, that potentially ingredients don't interact with one another for some reason, or that they're not going to crystallize and come out of solution due to chemical incompatibilities. So there just becomes more factors to look at there, but certain things can obviously be done. You could potentially lower volumes of agents used in a kit if a patient has a sensitivity to one. So for example, if a patient is very sensitive to magnesium in an IV drip, for example, like they get very lightheaded and tend to almost get sleepy and flushed or anything of that nature, you could back off just that ingredient in the kit, or even take it out, for example. But again, check the osmolarity with any changes and always document that to ensure safety, and know the different clinical outcomes of different osmolarities and what that looks like. So can you completely customize your own IV protocols? Yes, we have a ton of practitioners that do this. Can be done through a la carte ordering. So you can further customize drips in all sorts of ways, as long as you, again, make sure that things are chemically compatible, that they're not going to salt out or crystallize in the bag for some reason. Then different combinations can certainly be done. For example, you could take, as well as a simple example, our Immune Boost kit, and then you could add zinc to it and even further enhance its immune boosting capabilities. So a lot of different options here that can be done. And it just really depends on the practitioner and what they're trying to achieve with the patient. So again, I'm Casey Green, PharmD and certified functional medicine practitioner. I thank you for your time and attending this webinar with the Innovation Institute. And if you have any questions or needs related to IV nutrition or Myers cocktails or similar cocktails like that, just please give us a call at Innovation Compounding, and we'd love to help you out. Thank you and have a good day.
Thank you for listening today. Whether you are looking to expand your practice by adding an IV nutrition therapy segment, or you currently provide IV services and just want a refresher on the topic, this presentation was designed just for you. And education and information training like this is what the Innovation Institute is all about. If you enjoyed this lecture today, I urge you to sign up for future lectures to learn more about the topic. You can do so by going to our website at www.innovationcompounding.com/institute. As always, the pharmacy team at Innovation is here to answer your questions and accept your feedback. So please reach out to us. Thank you again for listening today, and be well.